Hey guys, in this video we're going to talk about the different effects from diabetes type 2 medication, okay? And this is based on someone's question. They wanted to know the different effects. This lady was on different medications and she wanted to know what they were doing to her body. So I said, tell you what, I'll just create a little video on it just to give you the overall picture. All right, so now we have pancreas that makes the hormone insulin. Insulin is traveling through the blood. It responds to carbohydrates, okay? And it actually, even protein too, its goal is to lower the blood sugar. So the pancreas releases insulin. It travels through the blood and goes into an insulin receptor. The insulin receptor then receives it and then creates an effect, one being lowered blood sugar, and then another being storage into either glycogen, which is stored sugar, or cholesterol, or fat. So there's mainly three different effects that certain medications create in this scenario. One is there's certain medications that increase the production of insulin being outputted right through here. Okay, so there's this little cell called a beta cell that makes insulin. So one of the medications that is actually very popular is called sulfonylurea. So this medication actually increases the amount of insulin being produced by the pancreas. Now, if someone has type 1 diabetes and they don't produce any more insulin, this will not work. So this just enhances what's already there. All right, the problem with this medication is that they also use it for an herbicide. Yeah, because it blocks certain amino acids in plants. So I'm like, wow, that's interesting. So is it safe for humans? Well, I don't know. There's definitely some side effects. One being increasing risk of cardiovascular disease and death. That's right. That's the warning on the label. So here you are trying to regulate your blood sugars, but then it's increasing your chance of dying from a heart attack. Okay, not good. All right. Another mechanism works on the receptor, the insulin receptor. People with diabetes type 2 have insulin resistance, so their receptors are not receiving that hormone very well. This is going to create a failure of the return feedback loop to the pancreas. So we're not going to get the shut off, like the turn off, because it's an incomplete communication. So the more that the receptor is blocked or resisting or downgraded, the more the pancreas is going to produce more insulin. So we're going to have a situation where we have a lot of insulin, but it's not really working in the body. So if you're going to take this medication, that can actually just add more insulin to a body that has too much insulin. The problem is it's not working over here, so you're not getting the effect, but you're getting a lot of the side effect of having the high levels of insulin. So Metformin, and there's other names for Metformin, increases the sensitivity of insulin. So it allows the insulin to be received more, okay? And there's actually a black label on Metformin that talks about one of the side effects being lactic acidosis, which is a pretty serious condition because the pH goes way, way up. One of the real natural remedies for lactic acidosis is vitamin B1. The problem is Metformin also depletes B1, so it kind of prevents the countering of that lactic acidosis. So it is a concern, a problem, but the way that metformin works is by opening up this receptor right here, okay? So then therefore the pancreas can actually lower the amount of production of insulin being pumped out. Okay, then the other mechanism is just by giving someone more insulin. So a lot of diabetics type 2 are also given more insulin on top of it, just straight insulin. So it's not necessarily causing the pancreas to make more, it's just giving you more insulin. Well, here's the problem. In type 2, many times the pancreas is already producing too much insulin because of the insulin resistance, not creating this feedback loop, this turnoff. So again, we're dumping too much insulin into the system for the purpose of keeping the blood sugars regulated and normalized at the expense of increasing cardiovascular risk, because that's another side effect from taking more insulin is you increase risk of heart problems right there, weight gain, and hypoglycemia. Okay, so because what happens, we have this push down blood sugar situation. Now you're irritable. Now they tell you to eat more sugar or carbs to raise the sugar, and then we start the cycle over again. So in summary, we have several mechanisms. One is to produce more insulin from the pancreas. Another is to just give more insulin, and the other is to increase the absorption of insulin. All right, so what's missing from the picture? Okay, what's missing from this picture is focusing on the root cause of why the body has high sugar in the first place. And that is because there are too many carbs in the diet. This is ignored. All right, guys, well, thanks for watching. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.